If you're a pediatric therapist, then you probably know that one of the ways to make sure that you're using evidence-based practices is considering client perspectives. My name is Dudek-Brannan, and I help pediatric therapists be better leaders so that they can be more effective and make a bigger impact with their services. And so that's why I wanted to talk a little bit about the evidence-based practice triangle and how to apply it to your practice so that you can make sure that you are practicing ethically and also that you are providing amazing results for your clients and your students. So the evidence-based practice triangle has three components, and it can be used to help therapists to make decisions and use science to pick the right intervention techniques for the clients that they're serving. So there's the evidence component, which is things like peer-reviewed research. There is the clinical expertise component, which is just basically using your past experiences and using that to make judgments based on what to do for your clients. And then finally, there's client perspectives. And the client perspectives piece comes up a lot in discussion groups, and it can cause a lot of really heated debates. And I wanted to clear up some of the confusion about what that actually means to apply the client perspectives piece to your practice in a way that is evidence-based. So basically what that means is that we're taking the available scientific literature, taking those techniques that are in our toolbox based on what's available, based on the peer-reviewed journals, empirical evidence, literature reviews, meta-analyses, and then we're also taking case study evidence that we might have from our past experience as a clinician. All of that gives us kind of a toolkit as far as what we can work with when we have a new client that comes on our caseload. But what we have to do in that situation is look at that client and look at their unique situation and figure out how to take what we have in our toolkit and apply it to their situation, and then help them implement it in a way that is practical for their real life. So this could be the way that they access therapy. This could be the supports that they need to put in place for their environment so that they can actually follow through on the things that you're recommending. This could be things like, which components of the treatment protocol that you're using they're actually applying to their situation because maybe they're not ready for all of it at once. It could mean a lot of things, but basically what you're doing is you're taking what you have and you're fitting it into their unique situation. What it does not mean is that the client totally gets to just dictate the whole therapy protocol, meaning that you're an expert, they're coming to you for advice, and they want guidance on an issue in their life that's causing a major impact on them. Well, obviously, you want to guide that intervention and let them know what is evidence-based and what things do work based on your past experience and based on the research. If you see that the client is not wanting to do something that is in their best interest, obviously, we wouldn't just say, oh, client perspectives, I guess they're not doing that. Obviously, we would want to talk them through it and do our best to get them to comply with the plan that we know is in their best interest. So that's where things get a little bit confusing. A client just saying that they don't want to do something because they don't want to change their habits, well, that's not necessarily using evidence-based practices. Obviously, you as a clinician do want to advocate for them and educate them as much as possible to follow through on whatever it is that you're recommending if you know that that's in their best interest. That is the ethical thing to do. Now, obviously, we can't force anybody to do anything that they don't want to do. But we also don't want to tell them that it's okay to not follow through. We want to be honest with them because that is the ethical thing to do. We do want to at least give them the information. We don't want to just say, oh, you don't have to do it because client perspectives. So that's where I see this getting kind of confusing in groups and just discussions and things like that. But it is important that we take all the tools in our toolkit, make it feasible for our clients, but at the same time, advocate for them and encourage them to change habits that aren't serving them.